Hi, everyone. Welcome to another episode of the KSP podcast. My name is Tony Morales. I'm the host and producer of the show. Today we have a special guest, Jennifer Avilez. Hi, Jennifer. How are you?
Hi, I'm good. How are you today? Happy Friday.
Good, good. Yes, it's Friday. Friday. Thank you so much for joining us today here at the Treehouse. This is what we call the Treehouse here at KSP. Um, but if you can please introduce yourself, what unit you're coming from, and what your role is.
My name is Jennifer Avilez. I'm KDAC 2, which is a state certified counselor in the state of California. I work in our recovery services unit here at KYCC, where we provide a treatment for substance use disorder issues. And I'm really excited to kind of come on here and talk a little bit about our program and what we offer, and also how we can help Koreatown continue to thrive.
Yeah. What is recovery services?
So, recovery services is essentially drug and alcohol treatment. So, we think a lot about treatment as rehab, right? Everyone hears, oh, I'm going to rehab. And people focus a lot of times on residential, where people stay there, live there, they eat there, they do all their treatment there. In regards to us at recovery services, we are the outpatient, where people come either after residential treatment as a step down to continue their care, or if they have supportive housing outside of treatment, or just their level of use isn't severe enough for residential, right? So for us, recovery services, we provide individual and group counseling for adults and adolescents. So the youngest a person can access services without the consent of a parent is 12 years old.
Mm.
And we have up to people in their 70s that come to get help. And then on top of that, we also provide connection to medications that help treat substance use and addiction. So when people really think about substance use, they sadly still think it's a moral issue. There's a big stigma. So we are showing them that, it is a medical issue. People don't, the first thing I learned in school was addiction is using regardless of the negative consequences, right? And there's multi layers to that, and it's multifaceted. So that is what recovery services is about.
Mm.
We work in tandem with prevention, but we do treatment for drugs and alcohol.
Okay. So prevention and recovery are two different parts, two different units, or what's the differentiation between both of them?
Yeah, so prevention has been around for over 15 years here at KYCC, and they're the ones that work with providing supports to young people that want to find things to do to keep them away from starting to use drugs and alcohol. They're also the ones that have done great, and shout out to prevention education PE. Honestly, they are the front lines, and they are doing some amazing work with the naloxone trainings and the way that they've really helped this community. Um, they're also the ones that have worked with all the different liquor stores around the area, which unfortunately we have a lot, right, in
Mm-hmm.
Koreatown, to lessen the potential sale to underage individuals, and also the smoke shops as well. So
Mm-hmm.
we are the people that um, prevention tries to prevent a substance use disorder from happening. We're the ones that, if it happens, we're the ones that provide them the counseling and the support to stop using.
Yeah, you mentioned that prevention has been here for some time.
Mm-hmm.
But I know that recovery is relatively new here at KYCC since 2019. Um, why 2019 would cause the creation of recovery services here?
So we got to go back a little bit to 2017. For a long time, Medi-Cal, because our program is Medi-Cal funded, would not fully cover drug and alcohol treatment. So in 2017, there was something called the ODS, drug Medi-Cal ODS, and a waiver, and it's a bunch of stuff that is, policy driven. But essentially, there was an expansion on Medi-Cal that provided services to people that qualified or have Medi-Cal to receive full spectrum substance use disorder treatment. So after a while, right, with prevention really leading the way for KYCC, we had the opportunity to get some funding and a grant through the waiver to actually open a outpatient program here in Koreatown. And in fact, we were one of the first, if not the first, in Koreatown to have recovery services.
Mm. You mentioned 2017 and how there was a shift in that moment. What led to that? Do you know?
So it goes back to the Affordable Care Act, understanding that, as the years have gone by, and I've been in this field for almost 15 years, and what I've noticed, right, is that we went from a place where addiction was still looked on as a moral issue, like I said earlier, turning into what they realize is a health crisis. Our drug program is funded through the Department of Public Health for a reason, right? And that's what started it. The transition from it being looked at as a solely behavioral issue or a behavioral model into a medical model is what changed that. So definitely more access to healthcare helped us build this program.
Mm. You mentioned substance, and when we talk about substance abuse, I think substance, there's a lot of things that fall under that. Could you give us a breakdown of what are some things that are common that fall under that category, or what are some treatments that we offer here at KYCC?
So we work under the harm reduction model. And the harm reduction model is exactly that, reducing harmful effects of substance use, where we provide naloxone trainings, right, to help counteract overdoses. We meet the clients where they're at because, number one, coming to ask for help when it comes to substances, for drugs and alcohol, we're talking about alcohol, methamphetamine, marijuana, opiates, heroin, fentanyl, where we constantly be hearing fentanyl, right? Fentanyl overdoses, fentanyl is in this, fentanyl is in that, all these substances. And what we provide is just a place where people can come where they're at, right? And we can start talking about that process. Some people come to us and they're like, my meth use is a problem, but I'm not going to stop smoking weed. And that's okay. And then we have the abstinence route, which are people that completely discontinue all use of drugs and alcohol. And that's something we can also support as well. So our program really much is that, right? There's no wrong way to come and get support. Mm-hmm. Right? Drugs and alcohol use is truthfully a coping mechanism, not the best, but a coping mechanism nonetheless. So what treatment recovery services does, right, our treatment program, is to teach these individuals a new way of living and learning to tolerate stuff, right? So we've seen so much is happening, right? We saw during COVID time, due to the isolation and the fear, a lot of people relapsing and using drugs and alcohol again after many, many years of sobriety. And we're seeing this now with all the raids happening here in LA, especially in, we service Koreatown, Westlake, Pico Union. These are communities that are being affected. Personally, I feel like way more than other communities here in LA County. So we're going to see an uptick of usage because it's a coping skill. We're going to see kids that are like, hey, man, I don't know if my dad's going to be home when I get home, or my mom. I'm going to use something to feel a little bit better. I can forget for 2-3 hours while I'm smoking some weed, right? So we're going to see an uptick of that. And we can talk about later, like what are the actual programs we do. A lot of people, again, it's that stigma, right? It's like, well, what are people going to think if they find out that I'm in rehab, or, we shouldn't talk about it. But the reality is, it's happening. It's here. It's in our communities. And in order for it to be, you can't fix it if we don't talk about it.
Yeah, most definitely. Yeah, because I wanted to ask a little bit more about that, specifically in Koreatown. Why a service like that is so important to have here in the community, here in Koreatown.
So we look at Koreatown, right? It's the diaspora, right? We have all types of people in this community. But the two major, communities we see are the Korean diaspora and the Latino diaspora, right? These are two communities that the stigma for addiction or substance use is so big. We don't talk about it, yet it's super acceptable to do, right? Both in the Asian culture and, the API culture, the Latino culture. Drinking is very, very acceptable and very common, right? And so that's the beauty of Koreatown that it's so eclectic, and it's so, you walk down the street and there's a Korean restaurant next to a Salvadoran restaurant, next to a Mexican restaurant, next to Bangladeshi restaurant. Like that's the coolest part of this part of town. So I think it's definitely that. It's the stigma. We're also super close in proximity to downtown LA, MacArthur Park. Um, like I said earlier, the fact that we have so many liquor stores within walking distance, like I said, PE's been doing a great job of trying to figure that out, and have more support, and not allowing certain liquor stores to sell, alcohol to minors, or smoke shops as well. And also, it's stigma,
Yeah.
you
Yeah,
know.
most definitely. Stigma. That's a word that I keep hearing you bring up. How can we as listeners, as also participants in our community, break that stigma?
Empathy. Ask questions, right? We're always available at Recovery Services Unit to talk about these things. In fact, in regards to stigma, September is Recovery Month, National Recovery Month, and we will be providing office hours for people to come in and ask questions, right? Talk about if they have someone they care about. I think it's also accessibility is a huge thing. So our program provides services in Korean, Spanish, and English. We're one of the only Korean speaking providers in LA County. So I think definitely just having that conversation and realizing that addiction is not a personality issue, or you're a bad person, right? And the fact is that recovery is possible. People recover and can have beautiful lives despite these situations they've experienced, right?
Yeah. Yeah. What has recovery looked like for the people, the community members that you have supported with?
So this is really cool that you asked this question, because we provide a survey to our participants or clients every year. So I actually have the report here, and I have a few quotes
Awesome. Yeah.
from this was our survey from October 2024. So our next survey will be here in November of 2025. So someone stated, I feel so liberated of any blame or shame for using and wanting help, right?
Mm.
Like the fact that they use the word shame, right?
Mm-hmm.
Because that is, stigma is the shame of having this problem,
Mm-hmm.
Another one of our clients wrote, people are caring, supportive, and non-judgmental upon one asking for help with addiction. I feel confident on my recovery with them by my side as a team to help
Wow.
fight through this.
That's awesome.
Yeah. Another one here said, people at KYCC always check on me and ask me how I am and if I need anything and if I'm all right. Right. And one of them even said, I like the services that are in the language I feel most comfortable with.
That's
And,
awesome.
there's a lot of different like modalities, right? When we talk about treatment, but something that I really put hand in hand with recovery as possible is that the opposite of addiction is connection, right? We saw this during COVID. Like I said, a lot of people relapsing and using substances again, or those that didn't even have substance use issues, right? The fear, the isolation, elevated, like alcohol use specifically. And so what we're trying to do at Recovery Services is not only provide the counseling and the education about the drugs and alcohol, but also provide them a sense of community, a sense of people care about me. I'm not the black sheep in my community. I'm not I'm not a bad person. And that's what the best part. I have been in this field, like I said, for 14 years. And when I came to KYCC, I was very, very, very impressed with how much this agency really gives back to their community. And I don't see Koreatown without KYCC, right?
Mm.
And so we have, the KSP where this program is able to talk about the history of
Mm-hmm.
Koreatown and its people, and the different experiences and the connections between the different cultures, right? It's
Yeah.
such a melting pot. We have, CD, where it helps people with financial literacy. We
Yeah.
have ECM, which can help people like access medical services.
Yeah.
We have clinical, which treats mental health. We have FSC, we have Kids Town, we have youth services, we even have environmental services that help, the community make this, the city beautiful, this community beautiful. So I feel like with recovery services, it's just that. It's another important like support to make the whole person and the whole community lively. And again, all these protective factors leads to recovery, and recovery is possible.
Most definitely, most definitely. And I think that's when I also think of KYCC is that once you join one of our programs or any of our services, you're also connected to all the other ones. In any way we can support you and connect you with all the other services that are happening, within the organization. Because when I think of like our students and our elders participating and telling their stories, there's a lot that comes with that, whether it be like bringing up different things in part of the history, realizing different things. So we're able to also connect that with the services that we provide. So I'm always happy to hear that, how we can all connect and collaborate in that kind of way. Um, you mentioned COVID and how much that impacted the services and the community. And you briefly mentioned on the ICE rates, but I do want to talk a little bit about more of that. Like, what is the impact of these ICE raids and how does that connect with the recovery services, the recovery process, and, just the overall community?
Again, isolation is a very, when I've talked to a lot of people while working in this field, and one of the, I say, top 5 trigger of using drugs and alcohol is isolation. It's the fear of the unknown. It's sadness, right? And with the ICE raids, we're seeing that. We're seeing the isolation, right? People can't leave their homes because they're worried that they're going to be grabbed, because frankly, they're not looking for people with lack of documentation. They're looking at someone, they look the part, they're grabbing you, whether you're a citizen or not, right? And there's that fear, right? Also, the fear of family members being taken or themselves, right? Or the fear of not knowing if they're going to be able to pay their bills because they're not going out to work. And people turn to things that work, right? And a lot of people, right? And we see that, right? In just the community, right? When you're having a bad day at work, oh, I'm going to go to happy hour because it's been such a hard week, right? Or, man, I had a bad breakup, I'm gonna go drink. Or, man, I just need a beer to take the edge off, right? Again, it's a coping skill. And I've had conversations with people that are like, what do you mean addiction is a coping skill? And I was like, it is. Is it a good one? No. But it's a way to soothe yourself and a way to just deal with how things are happening, right? So we do see that, like, for example, our funders, which is the Department of Public Health, SAPC, the Substance Abuse Prevention and Control Department, has even emphasized telehealth. They're aware of the raids, and they're supportive of us back to telehealth the way it was during COVID. Like, it's crazy to think, because it's 2 completely different things, but the results are the same. We're having to change things to virtual. A lot of people who were being able to access Medi-Cal are no longer applying because they're afraid that they're going to be flagged in one way or another, right? We're going to see that. So I do think 110%, at this moment, we don't know the full impact that these ICE rates are going to have on treatment and on recovery. Just like we didn't know at the time how much it impacted during COVID.
Yeah. But we definitely see it and we definitely feel it, right?
Oh, yeah.
Another thing I want to talk about is, you mentioned the harm reduction model and the model that y'all approach at recovery. For you personally, what influences your approach, or what influences the way you approach recovery?
the way that I approach recovery truly is what will make the person have a better quality of life, right? And that's what harm reduction is, right? Seeing somebody and that is maybe not 100% ready to completely stop using everything, but if there's no like if there's no negative consequence, right? And that is a very in the grand scheme of, we have two sides of the coin, right? In recovery and in drug treatment, alcohol treatment. We have the abstinence space, which is nothing, no drugs, no alcohol, and then we have the harm reduction, which is meeting people where they're at, right? We actually have a program in our department called CM, Contingency Management. And what it is for those who struggle with any methamphetamine, cocaine, or stimulant use disorder, they come in and they drug test for 24 weeks. The first 12 weeks is twice a week, and the second 12 weeks is once a week. And for every negative test for methamphetamine, they receive a gift card. They can't use it at any place. Like, they can't go buy drinks, alcohol, or weapons or anything like that. But they have access to like food. They can get gas, right? And so the way that I see it is like, there's no wrong way to get into treatment, and there's no wrong way to get into recovery. For me, I can't give you the message of recovery if you're not with us, if you're dead. And we see that with our overdose rates, right? I wonder how many of those clients felt like they had to do what the counselor or what the program wanted them to do. And like, I'm all for, self-efficacy, for autonomy, right? And it's important because, yes, I might be the counselor, but I'm not the expert of my clients' lives. And we can educate them, and we do, and provide motivational interviewing to kind of show them a mirror of like, hey, you're saying this isn't a problem, but, and we've seen that because in LA County, methamphetamine and stimulant use is the highest used substance, right? And so how this person can come into us, and because the program is based on motivational interviewing, and we praise them, right? They come in, they test, they do a negative test, and we're like, dude, that's so awesome. And even when they come in and they do test positive, nobody shames them, right?
Yeah.
Let me ask you this. If, say, you came somewhere and you made a mistake and they like talked down to you or made you feel less than, would you ever want to go back and talk to them?
No, never.
Never, right?
Yeah.
And
I was going to say, I think that also kind of, it reminds me, it's like one of those things where, like, even growing up, even for me personally, like, growing up and being certain things culturally, with everything going around, with things being instant, with labor, it's all this demand. And if you don't meet those expectations, there's always like this pushback and like this aggression towards you, Yeah. And I think a lot of those things also kind of, that's what it made me think about, like me growing up and like those thoughts that I had even as a child,
Yeah. And here's the thing, right? With the community that we serve, those thoughts are quite normal. It's that sense of like, no matter what I do, I can never get this right. And, a lot of our clients were, we're not the first treatment program, right? And what I see that differentiates KYCC's recovery services unit with others is that we come from a place of believing that you can get better, right? Knowing that if you do the work, things get better. And if that takes, a gift card program, right, of just being reminded, hey, I'm able to do this, right? And what we've seen happen with the contingency management program is people come in, I'm going to keep smoking weed and drinking, but I'm not going to use meth. And then what happens is, because at the end of the day, it's not about the substance. It's about coping, right? So they discontinue using meth, and all of a sudden their alcohol and marijuana use is up. And then as time goes on, we're talking to them and they're like, oh, wait a minute. Now I'm drinking a lot. Ooh, maybe I should talk about this, right? And you've already built that rapport and that connection where they'll be more honest with you, right? And the sad reality is a lot of people are like, you're what do you mean you're giving them gift cards? You're giving them money to not do drugs? And it's like, for some people, not using drugs for one day is a celebration, and it should be celebrated. You know, no one wakes up. You know, remember in kindergarten they asked you, "What do you want to be when you grow up?"
I said an astronaut.
You said an astronaut. I said
Yeah.
a doctor. I'm in healthcare now.
We're
right?
close.
But
We're both close.
close, right? But no one said, "I want to be someone dependent on drugs and alcohol to feel normal."
Right.
You know, I'm not going to use the derogatory terms that people call each other or call those who struggle with substance use and addiction, because it continues the stigma,
Yeah.
and I'm just not going to do that.
Yeah, for sure. Because sometimes I think about like language and how important that is, right?
Mhm.
Even like normalizing specific language and not and and there's like when certain things become normal, you just take it in subconsciously, and it influences you to do specific
Mhm.
things.
Yeah.
So I think most definitely it's important to also be aware of that. Even when we talk about it, right? The stigma and breaking that, like what language could we use
Mhm.
when speaking about stuff, right?
Yeah.
So yeah, I do want to talk a little bit more about Recovery Month. Recovery Month is in September.
Yeah.
Why or how do you know how it came to be that there's a whole month where we celebrate or uplift recovery?
So there is a national program called SAMHSA, and they are the ones that have ran recovery months for many years. Again, it's the importance realizing that there's a whole generation that we're losing to substances. I think definitely with the uptick of homelessness that we're seeing in LA, and the fact that I truly think that the opioid epidemic really kind of is what started this process, because addiction was hitting communities rampantly that before it hadn't been, right? Again, this is the sad reality, right, of the system and systemic beliefs that only people that are poor, uneducated, criminals are those that struggle with addiction. And then in the early 2000s, when we started having the opioid epidemic hitting affluent communities, it was like, oh, wait a minute. What do you mean it's not only these people? So that's where Recovery Month started. Again, it's advocacy, it's knowledge. If we talk about it, it becomes that less like dirty, oh no, don't talk about it, like hush hush, right?
Mm-hmm.
And that's where it came from. It's just, again, it's just advocacy and reminding people that recovery is possible, and that we're able to live a beautiful life despite our previous experiences with drugs and alcohol.
Most definitely. And what does recovery month look like for the recovery unit? Do y'all have anything planned for that month? What are we doing?
So we're going to be working with our comms team to post some stuff on our social media. This is part of our little recovery month things. We're also going to be starting our parent workshops. And those parent workshops are open to the community. So we're having our first one. It'll be conducted before this is aired, but we'll be doing parent workshops where we'll be introducing different types of most commonly used substances that teens use to the parents, to just educate them, right? Knowledge is power, knowledge is key, and also ways to talk to the adolescents. We are also going to be having office hours. So if anybody in the community or anybody listening, right, needs to ask a question about recovery, what that looks like, how they can access services, we'll be doing every week 2 separate office hours. We're going to be hosting one, which is Korean and English, which is going to be every Friday from 9 to 10 in the morning. And then our Spanish and English office hours is Tuesday, 5 to 6 p.m. on Tuesdays.
Awesome.
So yeah, that's kind of what we're doing. We're doing a lot of outreach, again, like reach out to the recovery services unit. Everybody in that unit will love to answer any questions, any concerns.
Yeah.
right?
And if let's say if they're not ready to be met in person, how can they reach out or how can they connect with the services?
So you can definitely go on our website. We have this really cool contact us button. We also have our phone number, and just you can give us a call.
Yeah. Any qualifications, anything that they need
So
to
in
know?
order to be part of our recovery services, our drug treatment program, you do need to either qualify or have LA County Medi-Cal. If you have other county coverage, we can facilitate in helping you get LA County Medi-Cal. And yeah,
Yeah.
that's basically the only requirement if you need support.
Awesome. Well, we'll also make sure to connect those links in the description of this episode. We'll also include all of that in our website, in our posts, so that way you're also able to connect with the services that we provide here. And in the same way that recovery, there's a bunch of things that contribute to that, that are systemic, that are personal. Like you mentioned homelessness, you mentioned COVID, you mentioned raid. And like I mentioned earlier, the same way, our services and our units are all connected with each other, right? It's the same way we address these issues or these things that we may need, right? It can be recovery, it can be storytelling, it could be financial support. We're all here to support you in any part and then in any service you may need here in Koreatown. Yeah. Thank you so much for being here, Jennifer.
Thank you so much. And like, honestly, at the bottom of my heart, like, I'm very honored to be working for KYCC, especially in our recovery services unit, because it is so needed here.
Mm-hmm.
And one person, right? It takes one person in one family to change the entire journey of their lives, right? And so, what our goal in Koreatown is to remind people that just because you've struggled with addiction or a substance use issue doesn't make you a bad person. And in fact, you're a miracle, and that life after addiction recovery is 100% possible, and it's a beautiful life.